abduction, so about there, and about 30 degrees flexion. So that's pretty close. So normally what I would do is put another pillow here, or just let that arm, is it comfortable there? Mm-hmm. Wherever it's comfortable. You can even let it, I don't like it getting out of neutral, but in this case we'll put it out of neutral, okay? Now, what I also have to do then, see how her shoulder's up? If I'm going to do glenohumeral mobilizations, I have to have some sort of stability on the scapula. So we're going to tuck that under. This is where some people have mobilization wedges, these little wedges you can put under. They work really well. The humeral joint itself, sand scapula, you're comfortable there. The book shows holding and coming this way. If you come from the same side, remember the angle of the glenoid is that way. I can't push straight down and get an effective joint because I'm going to compress. So if I were to push straight down, I'm going to compress. I have to go at an angle to allow the joint surfaces to move, to glide smoothly. So I come from the opposite side. This is where I differ from your book, and this works really nicely, is I can stabilize underneath, but if she's got a mobile wedge, I can just glide. All I have to do is, even with one hand, on the humeral head, I'm going to apply a grade 1 is what? An earnest look, right? So barely anything. There's a grade 1. There's a grade 1. There's a grade 1. Little, small amplitude, beginning of range, nice oscillatory. So if I'm going to do grade 2, you okay there? Mm-hmm. Large amplitude to mid-range. Now 3s are the opposite, large amplitude up to end range. Can you feel the difference? Mm-hmm. You guys don't do 3s. And then 4s, little oscillations at end range. So that's a posterior glide. Okay? Make sense? Doing is, if I take you and hold your, I can hold her on there, relax. 55 and 30 degrees, right? So now I can apply this left hand, I can stabilize, scapula stabilized with the sandbag, and then the left, my force arm, this is important, my force hand is this one, I'm going to take and glide the direction. So the forearm is dictating the direction of the glide. There we go. That's the anterior to posterior glide. Okay? So wherever that forearm is, that's where my glide is going to be. From this position, I can now switch around and do distraction. Glenohumeral distraction, I always tuck a towel because I don't like reaching into people's axillas. So we're going to go here, stabilize, and remember we're in loose pack position, and distraction means to distract the surfaces apart 90 degrees, right? So all I'm going to do is hold, stabilize, and there. Now, some people talk about stabilizing the scapula. I've got the wedge down there, it's holding things down, and I just glide out. So you're just doing grade 1s to 3s.
That's still mobilization.
Or 1s to 2s. It's still a mobilization, that's distraction. Okay? I can do them from the same position. That's joint distraction. Now, I can do joint traction. So for joint traction, I want to get down, and I'm going to use my hand here to lock in onto the blade of the scapula, and I'm going to traction down, long arm traction or short arm. So if I take my hand here, I can block that scapula. I'm on the lateral border of the scapula, taking my right hand on the distal humerus, and I can just step back to get distraction. Can you feel that? Or sorry, traction. Short arm traction. Long arm traction, just relaxed, would be that. Personally, I like short arm because we can control it better. Okay? See that? Now let's come up.
Good.
Okay?